minutes for everyone to join. Apologies, we had a few technical problems we were figuring out. How are you doing today, Doctor? Thank you for joining us on a Sunday.
Good afternoon, everyone. It's my pleasure to join over here.
Okay, we'll wait for about 2, 3 more minutes and we'll start.
Sure.
Okay, great. Good afternoon. I just wanted to take a moment to greet people that are joining in and you. Uh, very welcome to Mr. Dr. Anil Kumar. Thank you for being here. He's a board certified urologist, uro-oncologist, and a robotic surgeon. Dr. Anil has been trained in urological oncology, general oncology, transplantation, and completed his residency at the prestigious Christian Medical College in Vellore. With over 14 years of experience, he's treated multiple patients across various things, and we're so happy to have you here to have a very insightful conversation on our topic why waiting for an emergency is not the right solution for kidney stones. Okay, I
Thank you
think
for the invite.
thank you so much. I think let's start with basics. I feel because even I am equally curious about maybe why do kidney stones happen.
See, in about 95% of the cases, why kidney stones happen, the reason is not known.
Okay.
So, most common reasons apart from this can be like not drinking properly or not having adequate hydration, having foods rich in oxalates, uric acid more, and in 5% of the cases, this can be hereditary, where there are some genetic predisposition for stone formation. In such individuals, stone starts forming in very younger age from childhood itself.
Hmm. Okay, so you're saying some can be because of diet and hydration, and some are genetic. And for the major part, we don't know why stones happen.
Yeah, majority 95% we don't know,
Okay.
but in that what we have got what we know is that majority comes from not having adequate hydration,
Mhm.
and some dietary factors also have an important role in formation of the stones.
Okay. And having said that, I'm curious: does smoking and alcohol have an impact for the people that have alcohol or
Uh,
smoke regularly?
uh, See, alcohol directly does not have impact.
Hmm.
I have heard people talking about, okay, beer is used to flush out small stones.
Hmm.
Sometimes it can be true. Sometimes,
Okay.
like small
Okay.
stones, what happens
Hmm.
is when you drink alcohol,
Hmm.
there'll be too much of urine production,
Hmm.
which flushes out small stones. On the
Hmm.
contrary,
Hmm.
alcohol contains lot of uric acid. It
Hmm.
produces lot of uric acid, which is one of the common factor to form stone.
Hmm.
So people, if they think that okay, I am drinking beer to flush out stone, they should also be aware that alcohol can also increase formation of stone.
Oh, okay.
Smoking not a direct causative factor for stone.
Okay. So we say that the chances increase for someone who has alcohol to have stone?
Yes, yes,
Okay.
yes, yes. In majority of the patients, most of
Okay.
the patients.
So I think to our viewers who have alcohol, I think this is something to remember, definitely. I really want to ask you an important question. I think a lot of, I've heard family members be, upset that they have stones, etc. But I'm curious as to what happens inside the body when kidney stones are left untreated.
Uh, Kidney stones, they remain silent until and unless they come out of the collecting system. In the sense, whenever the kidney stone stays in the kidney, it won't cause any problem.
Hmm.
Whenever it falls down from the kidney into the ureter, which is the urinary tube,
Hmm.
then it causes severe pain, vomiting,
Hmm.
blood in urine. Sometimes the kidneys can get blocked and kidney can lose its function because of
Hmm.
hydronephrosis.
Hmm.
And whatever the urine stasis happens above this blockage, that can get infected and it causes a condition called pyelonephritis, which
Hmm.
is very dreadful for life.
Hmm.
Sometimes there is 5 to 15% mortality in such
Hmm.
infections.
Hmm.
If left untreated, if it does not fall into the ureter, the stones can grow inside the kidney and form the shape of staghorn and later on can damage the kidney itself.
Okay. Okay. So if people wait for longer, the chances of complications are much higher.
Yes, 100%. Whether it falls down into the ureter or whether it remains in the kidney,
Hmm.
complications can happen in both
Hmm.
the situations.
And doctor, what are some other complications people should be aware of apart from the ones you've mentioned?
See, I already told two deadly complications like loss of renal function, kidney can
Hmm.
get
Hmm.
lost. Other thing is infection.
Hmm.
Apart from that, there can be blood in urine,
Hmm.
vomiting, severe pain,
Hmm.
which is not tolerable in spite of oral medications and also injectables,
Hmm.
and it can cause recurrent infection also.
Hmm. Okay.
So kidney
Okay.
stones can form from infection and also it can cause infection.
Okay. Okay. So they can form because of infection and also be the cause of some infections.
Yes.
Okay. Okay. And so, a question arises. So you mentioned infections can also cause kidney stones, but then what are some other symptoms that might also mean that someone has a kidney stone problem? And how do I know that if the symptoms I'm going through are pointing towards kidney stone or something else?
Yes. Since you asked, as I told, whenever the stone is there in the kidney, it won't cause any symptoms at all.
Hmm.
The patients will be silent. They won't have any symptoms. The stones will be caught on some investigations like ultrasound or CT scan done for other problems.
Hmm. Hmm.
But whenever it falls into the ureter, it causes symptoms like pain, burning urination, increased frequency of urination,
Hmm.
blood in urine,
Hmm.
urinary tract infection can happen, fever can happen. Whenever the stone comes into the bladder from the ureter, the patients will have increased frequency of urination and they will have urgency also.
Hmm. Okay. So
These are few of the symptoms that can happen.
increase urination and pain and blood in your urination. But I've also heard of people having maybe pain on their sides or pain on their abdomen. Is that
Yeah, see, pain. See, if you ask about the pain, how the pain will be, and where is it located? What is the pattern of it?
hmm,
Whenever the pain depends on wherever the position of the stone is.
hmm,
If the stone is in the upper ureter, the pain can be in the flank region, in the side on either side of the back.
hmm,
So as the stones keeps traveling down, the pains keep shifting in position. When the stone comes to the terminal part of the ureter,
hmm,
the pain can get radiated to the pubic region and
hmm,
also tip of the genitalia in either of the sexes.
hmm, hmm. So would shifting pain be a good indication that it could be a kidney stone problem?
Rather than shifting pain, you can tell colicky type of pain.
Okay, that
Colicky in
means
the sense it's like a squeezing pain, excruciating pain which can't be tolerated.
okay, okay.
But having said that, even small amount of pain can also happen with kidney stones. It's not
Hmm,
always excruciating type of pain.
hmm.
Hmm.
So, pain is a symptom to look out for. Any other symptoms apart from frequent urination that could seem general but point towards kidney stones?
Sometimes there can be nausea or vomiting.
Hmm. 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 Okay.
Can happen stones in them.
So are UTIs related to stones as well?
Yes.
Okay.
See, in patients who have recurrent infection, chances of stone formation is more. In
Okay.
such individuals, the stones are called infectious stones. The
Okay.
composition of stones are different.
Hmm.
It can vary from anywhere between matrix stone
Hmm.
till what we call triple phosphate stone.
Hmm.
Uh, Other than that, stone itself can cause infection. Whenever the stone is there, it's not just mixture of some minerals like calcium,
Hmm.
oxalate, uric acid.
Hmm.
It also contains some microorganisms.
Hmm.
That's why whenever we treat a patient, whenever we powder the stone, these
Hmm.
microorganisms can get released into the urine stream and into the blood, and they can have post-operative fever,
Hmm.
chills, and they can go into sepsis also.
Okay. Okay. Okay, to the questions coming in, thank you so much. We will definitely take these questions after a while, after 15 minutes of discussion. So please wait around for the live Q&A. Okay, so I think I'm very interested to also know about a personal relative of mine, considering we were talking about symptoms and how maybe there could be some general symptoms that could point towards a stone. A relative of mine had a few stones detected in their x ray, but they never had any pain. I'm curious then about, say, about hidden symptoms and also a few apparent symptoms that you spoke about.
Hidden symptoms in the sense most of the stones are silent. They
Hmm.
won't cause any symptoms at all.
Okay.
So whenever you do some investigations like ultrasound or CT scan for
Hmm.
some other disease, or as a
Hmm.
part of general health checkup,
Hmm.
you can find out stones. If it's of a moderate sized stone and wherever it is, depending on the location of the stone, we can
Hmm.
treat it either conservatively or with surgical procedures
Hmm.
in people who get detected with stones.
Hmm. So you're saying there is maybe no way for us to gauge that we might have a kidney stone if the symptoms are hidden?
Yes, very difficult.
Okay. So are there any regular practices that people can do to make sure that, they know about they might have a stone or not?
Apart from symptoms, whatever I told,
Hmm.
if they are going for general health checkup,
Okay.
nowadays all people will have a preventive health checkup once in
Hmm.
a year.
Hmm.
They can ultrasound will be a part of the health checkup. They
Hanji.
can find out whether there is any problem in the kidney or whether there is any stone within
Hmm.
the kidney.
Okay. Okay, so we're talking about stones and detecting stones. Now I'm curious about what are some latest treatment options available because I'm sure people are very curious. I think getting surgery is a very, intimidating time for most people, but I'm curious to see if, come so far in advancements, what can we do to treat kidney stones and what are some options that we can consider?
See, historically, if you see kidney stones before and all, we need to open the abdomen, cut open the kidney, then take out the stone.
Hmm.
Then came the era of ESWL. It's
Hmm.
called extracorporeal shockwave lithotripsy,
Okay.
wherein shockwaves were given from outside into the kidney and stones were fragmented into different sizes, and those
Hmm.
fragments would come down through the ureter just as I told,
Hmm.
as a small fragments.
Hmm.
Sometimes what happens with this ESWL is the fragments can get stuck within the ureter and they might require a procedure.
Hmm.
Since you asked about the latest technological advances in treatment of stone, the
Hmm.
latest technological advances is use of lasers in treatment of stones,
Okay.
wherein we use laser with a different instrument like ureteroscopes. It can
Hmm.
be a flexible ureteroscope where we can go directly into the kidney where stone is there. We need not
Hmm.
wait for the stone to fall into the ureter, and we
Hmm.
powder it with the help of laser and remove the powder.
Hmm.
There won't be any cut. Patient usually can be discharged within 24 hours
Hmm.
and he can resume his duty from next day itself.
Hmm.
That's the beauty of this procedure.
Hmm.
Apart from this, whenever the stone is stuck in the ureter, we can use either laser or lithoclast. It's a source of energy to break the stone and
Hmm.
remove the fragments.
Hmm.
These are the two technological advances in treatment of stones.
Okay, so these are treatments that will not require an incision.
Yes, these are the treatment which does not require incision. These surgeries are done through our natural orifices through the urethra
Hmm.
and will trace back into the ureter and into the kidney, wherever the
Okay.
stone is.
Okay. And so, just so that we recap for the audience, there's one that is a shockwave therapy, and there's another that through the ureter, you reach to the stone and then you powder it so that it doesn't cause any problems, right?
Yes.
Okay. And then the incision type of treatment
Yeah,
would include?
incisional. Yeah, there are other treatment options where we use a incision. Incision can vary anywhere between a small hole, wherein we treat very big stones. Like it's called percutaneous nephrolithotomy,
Hmm.
PCNL
Hmm.
in short form,
Hmm.
wherein we puncture from behind or from the side of the flank and go directly into the kidney. using a camera and powder the stone or fragment the stone, remove the fragments.
Hmm.
This is a little bit morbid procedure because it involves puncturing the kidney. Why puncturing the kidney I'm mentioning? Because kidney is a very vascular structure.
Hmm.
It receives one third of our blood flow in the whole body per minute. That means
Hmm.
if we have 5 liters, out of that one third of the blood flows through the kidney every
Okay.
minute. So complications are more with this percutaneous nephrolithotomy, but it's a very minimally invasive surgery.
Okay.
Apart from that, we are opening the abdomen and removing the stone. Uh, Sometimes, if stone is very big, we can do laparoscopic either pylolithotomy or urethrolethotomy to remove the stone, depending on the location of the stone within the kidney or in the ureter.
Hmm. So, would it be safe to classify two types of treatment? One that includes incision and another that doesn't, roughly.
Yes, without incision and with incision. The two
Okay.
with incision, very minimally invasive
Hmm.
incision, or open surgery or laparoscopic surgery.
Okay, so having established that there are two different types of treatments, incision, non-incision, I'm curious then how what type of treatment fits what type of symptoms. I'm sure our audience also has the same question. What treatment should we go for depending on our symptoms?
See, it's not about depending on the symptoms. It's about depending on the size of the stone,
Hmm.
location of the stone.
Okay.
If size of the stone is say less than 2 or 2.5 centimeter, we can either go with RIRS, a retrograde intrarenal surgery,
Hmm.
or URS, ureteroscopic stone removal.
Hmm.
If it's more than 2.53 centimeter stone, as I already mentioned, we'll go for PCNL, percutaneous nephrolithotomy, or
Hmm.
laparoscopic pylolithotomy if it's too big a stone, more than 5 centimeter.
Hmm.
Nowadays, what are the size of the stones? Open or laparoscopic pylolithotomy is not in use that much. Very rarely people do it.
Hmm.
We do PCNL either one stage or two stage,
Hmm.
wherein in one stage we'll remove 50% of the stone
Hmm.
and go once again after a few days and
Hmm.
remove another 50% of the stones are in a later stage.
Hmm. Okay. So depending on the size, so you mentioned size and location of the stone will decide what sort of a treatment we go for.
Yes,
And
correct.
so, just curious for the audience, does bigger the stone are the symptoms worse for people? Does is that the case as well?
That also depends on the location of the stone.
Okay, okay.
If it's there in the kidney, it won't cause any symptoms at all,
Hmm.
whatever big the size is. Rarely there can be a dull aching pain on the side of the flank.
Hmm.
Flank in the sense on the side of the back where the
Hmm.
kidneys are located
Hmm.
on the upper back. But symptoms, even with small stones, symptoms can be very severe in
Hmm.
the ureter because whenever the stones moves down inch by inch, pain happens. If the
Hmm.
stone stays at some position, pain won't happen.
Hmm.
This is one of the bane for the patients.
Hmm.
People think that okay, I don't have any pain, so I need not go to the doctor. I need not get treated.
Hmm.
Also, some people might think like that,
Hmm.
but that's not a correct thing. But I'll be happy if patient has pain. That
Hmm.
means the stone is coming down.
Okay.
Otherwise,
Okay. So
stone might get stuck at a certain point,
okay.
and they might block the kidney and cause the loss of renal function. Kidney
Okay.
might fail.
So having pain is a positive thing because then the stone is coming down. That's
Yes,
interesting to
correct.
hear. Usually, people associate pain with the negative experience. They think maybe the situation is getting worse. But it's nice to know that pain can mean something positive as well.
Yes, with stone, I would be happy, but patients will be in pain. Sorry for that. But we can treat that pain with painkillers.
Yes, definitely. I completely agree. So this makes me think, is there a difference then? So why is it that say traditional methods you were mentioning one procedure that's not done as frequently now? Why is it that, what are these advantages of these advanced procedures? How are they helping us than traditional procedures?
See, these recent procedures, what they do is they can be done on a daycare basis. What
Okay.
is daycare basis? Get treated in the morning, go by evening or within 24 hours,
Hmm.
and resume your duty from next day itself
Hmm.
without pain or very minimal pain or loss of days from work.
Hmm.
That's what the advantages of this stone. And also, it's not about just going back to work early. Even the
Hmm.
stone clearance
Hmm.
will be more more than 99%,
Hmm.
almost equal to 100% with
Hmm.
newer procedures.
Hmm.
And we need not struggle for breaking or fragmenting the stone, because laser is such a wonderful tool in our armamentarium of the urologist. We
Hmm.
can break even the hardest of the hard stones.
Hmm. Okay, that's very reassuring to hear. So, advanced procedures help you maybe restart your life quicker and are more efficient, according to you?
Yes, correct.
Okay. Okay, great. Doctor, do you have any real life example of maybe a patient that you've treated who has had a, very successful advanced procedure surgery, and what was their experience?
See, I have treated many patients.
Hmm.
Since you have asked me recently, I had a patient, NRI, who had come
Hmm.
from Canada.
Hmm.
Don't want to mention his name.
Hmm.
He had just come here. The thing is, he had called me some 6 months back from Canada itself.
Hmm.
Doctor, I have a kidney stone. I am coming from Canada. I will be staying in India for 20 days. Can
Hmm.
I go back getting
Hmm.
the procedure done within 20 days?
Hmm.
He came back. We did a RIRS using laser,
Hmm.
and the next day he got discharged. Within 2 weeks, just before we stented him also. After pouting
Okay.
the stone, we put a stent.
Hmm.
Before going for Canada, got the stone removed. He was very happy, and he
Hmm.
went back. This is the recent
Oh.
one, very recent.
Hmm. So it's
This is
very.
how
Mhm.
this is how a technological advanced procedure can do to a patient. Minimal
Hmm.
complications,
Hmm.
very fast
Hmm.
recovery,
Hmm.
a fast resume to work,
Hmm.
and from second day itself, after the day of surgery itself, he was very much happy that he didn't know whether surgery has happened at all.
I
Yes,
think that is very surprising to hear, because the association people have with surgery is that they'll probably have to spend days at the hospital, they'll be in
yes, yes.
pain. But to think someone came from Canada, got their surgery done, and left the next week is, I think, a great thing for people who would want to get the surgery done. Definitely.
100%. For people who can't put leave for their job, they can get the surgery done on the weekend,
Yes.
go on Monday itself to the work.
Back to work.
Yes.
Yes, definitely. I think so too. But I think we've discussed treatment options. I just want to cover them again quickly for our audience. How is it that, okay, so we have URSL, which is urethra, please correct me if I'm wrong, which is urethra, kidney stones
U-
stuck in the
Ureter.
ureter, sorry, my bad, ureter.
See,
And there's
ureter.
RIRS that you've mentioned that.
Yes.
uh, so could you maybe help us, differentiate between these terms, because I'm sure these are the terms that people have
See,
held on to.
yes, yes. URSL in the sense ureteroscopic lithotripsy of the
Hmm.
stone. In the
Hmm.
sense, whatever stone is there in the ureter only, we can remove through this URSL.
Hmm.
We can't go into the kidney and remove it.
Okay.
We need a flexible scope for that to bend within the kidney and remove the stone.
Hmm.
So we can treat stones which are there in the ureter till upper ureter, or sometimes what happens in the upper ureter, the stone when you start breaking it will go pop up into the kidney, and
Hmm.
the stone might be lost into the kidney. It is
Okay.
called retropulsion of the stone.
Okay.
So ureteroscopic lithotripsy is best for mid-ureteric stones or lower ureteric stones.
Hmm.
Treatment of mid-ureteric and lower ureteric stones.
Hmm.
The RIRS is the best treatment for upper ureteric stones and also stones within the kidney.
Okay.
Uh,
Okay.
both Both procedures use different instrument. Here we use semi-rigid ureteroscope, but in RIRS we use flexible ureteroscope.
Okay. Okay.
Yes.
And you mentioned PCNL.
Yes, correct.
Could we cover that
PCNL,
again? Hmm.
yes, yes. PCNL is a minimally invasive surgery
Hmm.
wherein we make a hole or drill a hole through the back into the kidney.
Hmm.
Or directly puncture the kidney and drill a hole into the kidney and remove the stone from the back using the camera.
Okay.
This is called percutaneous. Percutaneous in the sense through the skin into the kidney and powder the fragment the stone.
Okay. Okay. Okay, I think yes, that makes sense. We've covered three different types of treatments. We've also discussed that the location and the size of the stone depends, is the deciding factor in what type of treatment to get. But so we've, covered the treatment, but I'm also curious, doctor. People get these treatments, but then there's always this instance of recurrence of stones. I'm curious, why does this recurrence happen? And are there some ways maybe to avoid this recurrence? Is there anything we can do to avoid it post a procedure? Okay.
Hope
No,
you are
doctor,
able to
your
hear.
voice is cracking and your video is getting a little blurry. I think your net connection's a little off. Can you hear me now, doctor? Okay, great. You were saying?
Okay.
Yes.
Once if a person has a stone, he has more than 50% chances of having one more episode of stone in the next 10
Okay.
years. So we can't 100% prevent the formation of new stones.
Hmm.
But there are certain things, if you do it, we can prevent formation of stone, if not 100%, at least maybe 70-80%.
Hmm.
Like drinking adequate liquids,
Hmm.
maybe water, other liquids, adequate hydration, what we tell,
Hmm.
and avoiding foods rich in oxalate and uric acids.
Hmm.
If you ask me, I can just spell out a few like red meat, palak,
Hmm.
dry fruits,
Hmm.
sprouted seeds,
Hmm.
sapota, dark chocolate. There are n number of items. If you search on Google, it will show around 150, 200 items.
Okay.
Foods rich in oxalate and uric acid. So
Okay.
what people tell, sir, I should not have anything at all if I see this list. What I tell for those people is just you should have everything, but in a limited amount, whichever is
Yeah.
which how much ever is required for your body.
Hmm.
And apart from that, don't add excess salt into the food. Whatever
Okay.
salt is added into your food before while cooking, that's more than enough. These
Okay.
are three important things you should do in order to prevent a formation of recurrent formation of stones. And
Okay.
apart from that, obesity is one of the formation. Obesity is one of the cause for formation of stones.
Hmm.
People Obesity is one of the formation cause for the formation of stones, and also diabetes is one of the cause for formation of stones.
Hmm.
So having a healthy lifestyle,
Hmm.
reducing weight, uh, then controlling diabetes, these are all few things which can prevent formation of recurrent stones.
Hmm. So you mentioned salt in excess salt in food as well. So does excess salt in food also contribute to the reformation of stones, or does it contribute to formation of stones in the first place?
Both are true.
Okay. Okay. So
I
you
meant
mentioned
stone. I meant salt, not calcium salts. Normal salt, common salt.
okay, common table salt. Okay.
Yes, people
Okay.
have the notion that if I take a lot of calcium tablets, I'll have formation of stones. That's not correct.
Oh, okay.
Yes, every people require around 1000 milligram of calcium per day, 1000 to
Hmm.
1500. So that much, even if they take around 3 to 4 tablets of 250 or 500 milligram each, they
Hmm.
won't have formation of stones.
Okay.
The formation of stones rather in them is equal to normal persons.
Okay. Okay. So taking calcium supplements does not contribute to the formation of
No.
stone. Okay. Okay. So, but any reason why you mentioned, they within the first 10 years of stone removal, stones come back a bit. Do we know why this happens?
Uh, as I already told,
There's
95%
no.
of the cases we don't know what is the cause.
Okay. Okay.
Once stones form, they have certain things in their body where they are prone for having formation of stone.
Hmm.
That's very difficult to identify what is there. It can be either citrate level low or increased citrate level or calcium level high or oxalate level high in their urine. All these
Hmm.
factors contribute to the formation of stones, whether it may be first time or recurrent.
Recurrent. Okay. And I'm curious, doctor, the treatment plans, treatment options we discussed right now, are they valid for someone who's, getting the stone problem again? Can they still go for the same procedures? Is it safe for them to do so?
Yes, it's 100% safe. The
Okay.
same procedure can be done n number of times in any individual. If it's
Okay.
done properly in safe hands,
Okay. Okay. Noted. And I think that makes a lot of sense. We've covered maybe, some things that you can remove from your diet so that the recurrence of stones doesn't happen. And it's very reassuring to know that these minimally invasive procedures are still useful for someone who has a recurrent stone problem. So, to anybody in our audience who's had that question, I hope that's been cleared. I really do want to ask you, Doctor. I mean, the entire premise of our webinar was to why wait for an emergency? So I think an important question to now ask is what is the difference in outcome between, say, a planned procedure and an emergency intervention?
Um, there is nothing a sort of difference between a planned procedure or emergency procedure. But emergency procedure, patient would already have experienced the pain.
Hmm.
In a planned procedure, patient won't be having any symptoms. We'll be planning and preventing the stone getting dropped down into the ureter.
Hmm.
In a emergency procedure, patient will be wincing with pain. Will have
Hmm.
some complications of the pain like obstruction, hydronephrosis, or
Hmm.
infected kidney system like pyelonephritis. In
Hmm.
such situation, we need to treat the stone. Emergency.
Hmm. Hmm. Okay. So, say if a patient has a 1.5 centimeter stone, maybe one or two of them, but they don't really have any symptoms or they don't have a lot of pain. Should they wait to get it removed or should they get it removed as and when they get to know each other? Get to know that they have stones?
No, 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 no. One, no, 1.5 centimeter stone is like too big a stone to just be like that.
Okay.
Keep it like
Hmm.
that without treatment.
Hmm.
All stones more than 8 10 mm in size needs to be treated.
Yes. Okay. Yes. Okay. Okay. So your idea is that we get the stones treated as soon as we get to know that we have stones. Do not
Yes,
wait for an
yes,
emergency.
correct. If you don't
Okay.
treat it,
Hmm.
they will cause you pain. Once you start having pain, you will only come back for getting treatment. If you
Hmm.
treat it on an elective basis in a on a planned
Hmm.
day, it will be both easy for you to get back to work. Otherwise, you need to put unplanned leaves.
Okay. Okay. Noted. I think, but I'm just wondering now, is it financially also smarter to plan treatment or wait for emergency, considering you've mentioned the pros of waiting, not waiting. So I'm wondering if will it be helpful financially as well?
See, financially, yes. The lasers, when it came, it was a bit costly. Nowadays, lasers are available everywhere in auto or hospital. So the finance part also, it is taken care of by insurance. Insurance also covers all these laser surgeries nowadays.
Hmm.
And also people who don't have insurance, it won't be that much of a burden to them. It can be done at a very minimal cost.
Hmm. Hmm. Okay. And speaking of cost, how much do these treatments roughly cost for the audience's awareness?
If you're talking about a unilateral RIRS,
Hmm.
it may vary anywhere between 1.5 to 3, 3.5 to 4 lakh, depending on the hospitals.
Okay. Okay. I think we have roughly covered all our questions, Doctor. Is there anything that comes to mind? Maybe you've had a patient experience that you think is valuable to share if we've missed anything in our questions, post which we'll take some questions from the audience as well.
I wanted to since I didn't, I mentioned only ureteric and the kidney stones.
Hmm.
There are certain stones that can form in the
Okay.
urinary bladder, vesicle stones, what we call.
Hmm.
It can be either drop down from above or it forms directly in the bladder when where there is obstruction to the flow of urine,
Hmm.
like stricture cases, prostate enlargement cases where urine is not getting emptied fully.
Hmm.
In such cases, as a part of complication, stones get formed in such urine that needs to be removed.
Okay. Okay, so we also have. So will the treatment options we spoke about will they also apply to stones in the bladder?
No, no, no. Stones in the bladder, they will be removed either by cystolithotripsy or cystolitholopaxy.
Okay, okay, so separate treatment options for those.
Yes.
Okay, I think we'll take a few questions from the chat. Someone has asked, as compared to open surgery, how much do the laser or advanced procedures cost?
Open surgeries, as you think, won't cause minimal nowadays.
Hmm.
But obviously, technology fares far better over open surgeries.
Hmm.
And since technology or laser is used, we have to pay for it.
Hmm.
No technology comes at a reasonable cost.
Hmm. But I think we've discussed the pros of going with advanced treatments, and they're more efficient, and the daycare surgeries, so people can be back on their feet maybe the next day, like the Canada patient example you gave. Okay, great. I think that sounds good. Someone's asking if the stone is big, can it still be treated without surgery? Okay. So I think there are some people afraid of surgery in the chat. But I think with the treatment options we've discussed, the surgeries don't sound as overwhelming as they usually do. Uh, Mr.
Uh,
Abdul, sorry,
if I
yes.
if I want to tell our audience or speak listeners, you need not worry or panic about surgeries nowadays.
Hmm.
You won't feel that surgery has happened at all.
Hmm.
You can trust me, or you
Hmm.
can bet on the procedures.
Hmm.
I have seen patients who come now just like that and go back
Hmm.
within 6 hours.
Hmm. So I think taking care of your health has become slightly more easier now. Mr. Abdul asks if a person is a CKD and on dialysis and has output around 200 to 300 ml, has stone in both kidneys and size of stone is 10 what is the procedure suggested? Hmm. Okay.
People also,
Hmm.
but 100% it has to be removed before transplantation.
Hmm. Okay.
You can't just leave the stone behind there and do a transplantation.
Hmm. So they mention their age is 1237. Is there an age range for which these treatments will work better? Is there anything like
Nothing,
that?
nothing. It can be done for even pediatric population also. It can be done for old age also.
Okay. Okay. I hope that answers your question, Mr. Abdul. We're getting another question. They say, how painful is recovery compared to passing stones naturally?
Uh, as I already told, stones won't come down that fast. It
Hmm.
might range anywhere between a week till 3 to 6 months also. When now
Hmm.
stones come inch by inch or in centimeter by centimeter or millimeter by millimeter, every time there will be pain. And pain won't be that much mild. It will be severe enough.
Hmm.
Well, you should ask about the pain with people who have experience rather than just me telling over here. They will tell
Hmm.
you properly.
Hmm.
So 100% if you are waiting for stones to pass naturally, it will be a painful procedure or
Hmm.
painful course.
Hmm. So it sounds like maybe treatment is the better option here.
Yes. Either if it's a small stone, medical treatment, or if it's a big stone, surgical treatment.
Hmm. Hmm. They're also asking RIRS procedure for stone removal. Is it covered under insurance?
Yes. Almost majority of the insurances it covers RIRS.
Okay, I think yeah, someone's asking, sometimes they get pain in their side, but it goes away. How do they know if it's a stone or just acidity?
Just go and get a imaging done. Normal ultrasound scan should be more than enough.
Hmm. Okay, and you also mentioned the type of pain that is important to take note of, the squeezing type of pain to know if it's a stone or not.
I already mentioned also, along with the colicky type of pain, I already mentioned
Hmm.
sometimes pain can be very mild also. People
Hmm.
ignore it for that.
Hmm.
It can vary anywhere between mild to severe colicky type of pain.
Hmm. Okay, I think we
So,
have covered almost all questions. We'll take one last question. If the audience has any other questions, this is a good time to put these out now.
someone has asked, my cousin's X-ray is showing
Yes.
kidney stones, but he does not have pain. Yes, sometimes these silent stones can be dangerous. because if it does not come down, they can grow in size, as already told,
Hmm.
or sometimes it can fall down into the ureter and be painful and cause more damage to the kidneys and also to the patient.
Hmm. Okay, I think we have covered mostly all questions. And we Yeah, thank you so much for your time, Doctor. I just want to let the audience know that you will get a custom free consultation with Dr. Anil on the WhatsApp community, and the link is also pasted in the description. If you have any other questions, please feel free to ask them now. And thank you so much for your time, Doctor. I think that's all we have for questions. We've covered quite a lot in this session. We've roughly covered the treatment options. We've also covered what sort of symptoms can maybe signify a stone. We've also talked about recurrence of stones. And we briefly also covered how diet and maybe a healthy lifestyle and hydration can impact stones in your body. So, yeah, I think it was a very insightful conversation. Thank you for your time.
Thank you.
To the audience, once again, we will be dropping a link where you can book a free consultation with Dr. Anil, and the same link is also in the description of this live. You'll find this live on Medfin's YouTube channel, and you can access it anytime. Great. Thank you so much, Doctor. Thank you so much.
Thank you.